tuning in today, everyone. I just want to let you know my book is out and available on Amazon and Barnes & Noble. The name is Parents, Our Greatest Teachers. And now, back to our episode. Hello, everyone. This is your host, Alex Valgood, and this is Leap of Health. And today we have Dr Chiaramonte. She's a doctor, and I'm super, super excited to have her today. We're going to be talking about palliative medicine. And before we go into that and what that means and what she does for that specific topic, tell us a little bit about yourself and how you got to be at this point in your life.
Sure. Thank you so much for having me. I really appreciate it.
Thank you.
So I started out as a family doctor and I practiced regular old family medicine in a rural clinic. And I found that there were some patients, of course, I could get better with the medicines I learned in med school, but there was a whole bunch of people who had things that made them feel lousy, but nothing showed up on tests, like they were tired and they had headaches and their stomach felt funny and they couldn't sleep and they just felt lousy. But we did all the tests, all the things, and we couldn't find anything wrong. And so in the beginning, I was like, why didn't they teach me what to do for these people? It was often women. It was often women between maybe like 30 and 60. And eventually I just started trying to share with them things that I did for my own well-being, sleep, movement, eating healthy food, noticing their thoughts. Like, are they saying to themselves, you're stupid, you're stupid, you're stupid, it's never going to work out, everything's terrible. And making some changes in those automatic thoughts. We talked about their work and did they like it? We talked about fun and relaxation and were they putting it into their life? We talked about their relationships. And then poof, these people started to get better. And all of a sudden they weren't so tired and their mood was better and they were moving and they felt stronger. And that got me really interested in the whole field of integrative medicine, which I didn't have a word for before. I'd never heard of it before. And I thought, wait, like this is a whole thing. And how come nobody taught me this in medical school? And then I discovered, yeah, it's a whole thing. It's a field. It's called integrative medicine. And so I went in that direction for a long time. And I was the associate director of a center for integrative medicine at a med school in Maryland for about 10 years. But then I had just kind of by accident in that path, I started working at a hospice. And I was totally blown away by what I found at this hospice, which was that many of the people on hospice were happy, which is kind of the opposite of what they taught me in med school, right? Like sick people are unhappy. If you make them unsick, they'll be happy. That's what I learned. And these people often, not everyone, of course, but often had a different way about them. And they were more settled and content with today. And I was really interested in that whole thing, like what makes that happen? And so, of course, when you are faced with maybe coming to the end of your life, you get a really important awareness about what you want for yourself right now. And that can change your whole perspective of living. And so I kind of had this interest in hospice on the side and became board certified in palliative medicine, which we can talk about in a minute. And then I had kind of these two separate interests. And most recently, I put them together and became really interested in the integrative approach to people with serious illness. Some people in the integrative medicine world are already pretty healthy, like young, healthy, vibrant people trying to prevent disease, which is great. But some people, they didn't prevent the disease, they have disease. And I never wanted to feel like the integrative approach was only for healthy people, not for sick people. And so that became the thing that interested me professionally, was this whole person integrative approach, but for people with things, people with conditions, significant conditions. And then me, myself, I have two young adult daughters and a husband and a Chihuahua that I live with that are very, very important to me and a big part of my own well-being.
Yeah, no, I love that. And I like that you mentioned that those two aspects of what you're doing, the integrative medicine and the palliative medicine. They're kind of like very two different things. And as you mentioned, integrative medicine, a lot of people are doing it to prevent disease and to keep well, but it's really cool that you are mixing those two for people that, even though they have like cancer or diseases like that, that that they might know there's gonna be the end soon and things like that, you can make it better.
Yeah, for sure. And even for some people, the end isn't soon. So the thing a lot of people don't know about palliative medicine is that it's not end of life care. It's not. Hospice is, but palliative medicine is not. It's just symptom focused care for people with serious illness. So symptom focused meaning we're not trying to like kill the cancer. That's the oncologist's job, but it's focused on the well-being, the physical, emotional, spiritual well-being of the person who has a serious illness. So that means also people with early stage breast cancer who are going to get cured. But in the meantime, they have to go through chemo or radiation or surgery. And so they have symptoms. Maybe they're anxious or depressed or stressed out. They have pain. They're nauseous with chemo. They're tired with chemo. All of that counts for palliative medicine because they have a serious illness, cancer, but even if it's going to be cured, it still counts. So people think sometimes that it means like you're definitely going to die or it's end of life.
Right.
It doesn't. Just means you have a serious illness. So like, if you're 16 and your worst thing is acne, probably you don't need palliative care. But
Right.
if you're 49 and you got diagnosed with a cancer, even if you're hoping for cure, for sure. Or if you have diabetes and your kidneys are starting to fail, then yeah, you're still hoping to live a long life, but you definitely have a serious illness. So it's the focus on the person rather than the disease, which is what I liked about it. And that part is philosophically very similar to integrative medicine, which is also focused on the person, often trying to prevent disease, but both have the kind of philosophy of it's not about the disease, it's about the person.
That's nice. That's awesome. Because I think we also do forget about what the person is going while they're ill.
Yeah.
So what are some of the things that you use in palliative medicine with this type of patients?
So palliative medicine, straight up regular palliative medicine, has this philosophy, like we talked about, of physical well-being, emotional well-being, and spiritual well-being. So for physical well-being, we often will use medicines. If someone's depressed, we'll treat them with medicines for depression. We'll treat pain with various kinds of medications, sometimes opiate medications, sometimes not, sometimes seizure type medications like gabapentin, sometimes Tylenol or nonsteroidal medicine. So medicines for pain, we have medicines for nausea, medicines to make your bowels go faster or slower, depending on what you need, medicines for fatigue that comes from chemotherapy. There are procedures in palliative medicine, of course, and there's a good and important awareness of emotional well-being. So palliative doctors also have really strong communication skills and counseling skills. We often will help families communicate with each other, which does not often happen when someone's, in the hospital and one daughter's in California and one's in North Carolina and one's here, and then everybody's having, problems communicating or making decisions. So palliative medicine helps with that. It helps the family, patient and the family communicate with the medical team, because sometimes that's complicated too. There's, 4 doctors saying different things and no one knows exactly what's going on. So palliative doctors help with that. It really is focused on what the person needs. And so what it's my dog crying, sorry.
Right.
what integrative palliative medicine is all that same goal, but just with a bigger toolbox. And that's why I love it so much. So including all the medicines and stuff we talked about, but also, if it's appropriate, acupuncture, massage, craniosacral therapy, guided imagery, meditation, qigong, tai chi, yoga, exercise, positive psychology counseling, mindfulness-based stress reduction, et cetera, et cetera, et cetera. So just a bigger toolbox to help the patients in the same way. So from my perspective, all palliative medicine should be integrative palliative medicine, because why would you only have a little toolbox when you could have a bigger toolbox?
Yeah, of
And
course. Go ahead.
just I was going to say, there are also some inpatient teams that are just integrative medicine. I used to work with one, which is great, but sometimes you need medicines too. You know, like if someone has really severe cancer pain, yes, they should get acupuncture and massage, and yes, they should meditate, but you know what? They might need morphine too, actually. And so having the same doctors, the same providers be able to do all of those things together, from my perspective, is ideal. And in the practice that I was with for quite a while, it really worked well, so that the patient doesn't have to go all over the place for different things, you know,
Yeah.
having it all in one place, all focused on the mind, body, and spirit of that person, while other people are working on the disease process, other
Yeah.
doctors.
Yeah, for sure. I like that you mentioned. I like that it's coming from an empty that you're saying it. In my show, I have a lot of holistic practitioners that do different modalities, and quite often they find themselves kind of like by themselves because it's kind of hard to work with the primary physicians or other MDs because they don't quite understand the importance of working together. I had
Yeah.
one of my guests that said, a person is a whole system. It's not just like the elbow or the heart or the adrenals. It's like a whole system, mind, body, and soul, as you mentioned. So I love that you're pointing those things out. It's great because and we need more MDs like you for sure.
Well, that's so
Uh,
funny you say that, because what I'm trying to do now is train doctors in this,
mhm.
because this isn't weird. You know, once upon a time, doctors felt like there's conventional medicine, and then there's like all a bunch of weird stuff that they don't know anything about and there's no evidence for, which is not true anymore. You know,
Exactly.
for a while, there wasn't a lot of solid evidence for things, but now there is. And
Hmm.
so the same way that we use in medicine medications and procedures, etc., we don't say, well, do medicines work? Like, that's a dumb question, right? Because the answer is, well, it depends. Like, they work for some things, they don't work for other things. If you
Hmm.
have cancer and you take a heartburn medicine, it's not going to help you, or vice versa. If you have heartburn and take a cancer medicine, that's not good either. The question
Right.
is, does this thing work for anything? And if so, what? And we should talk about all of the complementary modalities in the same way. So acupuncture, it's not like acupuncture's in or out, good or bad. Like, yeah, use it for everything or nothing. No, like, let's look at it. Let's see, does acupuncture work for anything? Yes. And if so, for what? And what does the evidence show? And so it's really not a leap anymore for physicians to integrate these sort of modalities into their care of the patient. But we don't really learn that. And what I
Hmm.
my goal is to help regular old physicians get this, because there are integrative physicians who have done a fellowship, they have a whole practice, their sign says Dr. Integrative Medicine,
Hmm.
which is great, but really it should be integrated just into the care that every doctor gives. And so you don't have
Yes.
to be an uber expert, you don't have to be an acupuncturist doctor to know what the evidence shows about acupuncture and when you should recommend it to your patients. So I'm on a
Yes.
little personal crusade to teach
Yes.
doctors who take care of patients with illness, real, significant illness, this integrated palliative approach, which just means whole person care with a bigger toolbox. That's all it means.
That's awesome. We really need more and more MDs like you because at the end of the day, it's not the doctor. It's not, it's about the patient. It's about
Yeah.
how we can help the patient in the best ways. And I love too that you're pointing it out that, as acupuncture works for some people, it might not work for others. Medicine might work for some people and not for others, and there's
True.
different things, so that's like really really outstanding. So
Thank you.
we really applaud you for that, and I hope if there's MDs listening to this, just open-minded, see what other holistic practitioners have to offer and how you can incorporate that into your practice. I think that's like the best way to, it's like a win-win for everyone, and I think it's so cool.
I totally agree. And if there are MDs listening, contact me,
Yes.
because I take an evidence supported approach. So I don't believe just because something is not conventional medicine that everybody should have it all the time. It's great. No, I want to know, like, what's the safety, what's the evidence. And for some things, if you don't know the evidence for benefit but you know it's safe, that's fine. Like, for example, if the patient says every time I meditate my headaches go away, even if you personally are not familiar with the evidence around meditation, which by the way does show benefit for pain and anxiety, depression, headaches, etc. But even if you didn't know that, you probably know meditation's safe. And so that would be a thing you could support as a physician for your patient. On the flip side, if a patient is on blood thinners like Coumadin and they come in with a huge bag of supplements that they're taking all the time that they got from the drugstore, in that case, the physician might want to know, okay, what are resources where I can check supplement drug interactions? Because there are some medicines and supplements that can interact in a bad way that wouldn't be safe. So
Mm-hmm.
my goal is for physicians to bring like the same evidence supported approach to try to help people, but just be open-minded and don't assume that only pharmaceuticals and procedures are the only things that have benefit, because that's not true. We really
Mm-hmm.
truly know that's not true. And
Yeah.
also you can incorporate these things and still have the same doctor sense, like still be an evidence, be a scientist, be an evidence supported person. You don't have to
Mm-hmm.
become a different person. You don't have to become a naturopath to understand what the benefit is, for massage in patients with pain in their neck and shoulders, for example. Like, there's a knowledge base that
Mm-hmm.
physicians could learn, and I want to teach it to them. So send them my way.
I will.
Okay.
No, but that's awesome, and I love listening to you and how you really want to you know do this work of having more MDs become more having more tools in their belts. They already are like super awesome. All MDs, I think they are. But adding all these extra tools that been here for a long, long time,
Yeah.
as meditation and acupuncture has been here for 4,000 years,
Thousands of years.
and
Yeah.
you know herbals and things like that been here for a long time, and they've been proved to work for a lot of things. So might as well just put them in your toolbox and use them for the well-being of your patients as fitted, obviously. So that's really awesome. And like me, I never heard of this palliative medicine. If someone out there has some sort of like disease like cancer and uh, kidney disease and all these things that might need some of these cares, how me as a patient, how do I go about finding a physician that's within the palliative medicine? Do you ask your primary physician, or do you just Google this? How do these patients come to you?
It's a good question. You can do any of those things. So you can ask your primary physician, who hopefully will know of some palliative medicine physicians. They're almost always available inpatient, like when you're in the hospital. It's a little harder to find somebody outpatient, but you can do it. To find an outpatient clinic, often you would go to a hospital and look on their website. Often
Mhm.
hospitals will have attached outpatient palliative clinics. But also you could Google in your town palliative doctor. If you have one of those, like, oh gosh, the Washingtonian, or we have Baltimore Magazine. Like, if there's a
Okay,
magazine with your
the
town's
local
name on it,
medicine. Okay.
yeah, that often has like top docs or that kind of thing. There's usually a category for palliative medicine, and you can
Mhm.
go onto their website and look there. There aren't as many of them as there could be, and it's a field that's growing. It's a relatively new field, not totally new, but newer than some.
Mhm.
But it's growing, so you definitely can find them. I would I would start by asking your primary care doctor, and if they don't know, I would look up the hospital websites that are in your town.
Okay.
But
So
it's appropriate for, oh, I'm so sorry.
go ahead.
Oncologists often will know somebody, and they often will be affiliated in some way with the palliative department. So anybody who has a serious illness, like you said, who's having symptoms like they're tired, they're nauseous, they have pain, they can't sleep, they're constipated, their stomach hurts, that would be an appropriate person to go for a palliative consult. I do just want to say partly why sometimes people think that palliative care means they have to give up their aggressive medical care. They do not. Is
Mm-hmm.
because one of the things that palliative doctors do is help patients make medical decisions. And so sometimes that decision is, yes, I want to be aggressive with care. Sometimes the decision is kind of already made. Like if you're 45 and you have an early stage breast cancer, you're pretty much for sure going to go try to cure that thing. And so then we don't have to have a conversation about decisions. But sometimes if it's an advanced cancer or a 90-year-old person, with a new diagnosis, they may decide, you know what, I don't even want to do that. And that's okay too. So we help people make those decisions. But the care of the person from a palliative perspective starts with diagnosis of a serious illness and goes
Go
as
from
long
there.
as the person needs, goes from there. Yeah.
Okay. So safe to say that most of the hospitals will have uh, one of the physicians kind of like on site or to refer to.
Yes. And one of the things I'd love to say about that is even doctors, non-palliative doctors, often don't really understand palliative medicine. It's part of we have a marketing problem in palliative medicine, but we're trying to fix it. But even the doctor may not suggest it, even though it's appropriate, because some of the doctors they misunderstand and they think it means, oh, only when you're stopping treatment. So doctors will sometimes think, oh no, you don't need palliative medicine, even though you're in the hospital and you're miserable and you have all these symptoms, you feel terrible, because you're still going to get chemo. So they're totally wrong about that. You can be pursuing aggressive care to try to get rid of your cancer or your condition, and still it would be perfectly appropriate to have palliative care. So I think it's important, that's why I love that you're doing
Yes.
this, to
Mm-hmm.
educate the population to ask. Because if you're in the hospital and you say, hey, I have advanced kidney disease or advanced heart disease, and I'm really short of breath and I feel terrible and I'm exhausted, I would like to talk to palliative medicine, they'll get you a consult. They may just not suggest it because the doctors may also be misinformed, but you can ask.
Yeah. Oh, okay. So that's great. So for anyone that, has a family member or whatever that's maybe going through something like this, I know that you could, if it's for your symptoms and you've been diagnosed with like all these diseases, you are a good candidate to go for a consult and see how they can help you.
Exactly. And the reason to do that, people are always surprised to hear me say this, is because palliative medicine is all about living. And if you have pain, you're nauseous, you're tired, you have diarrhea, you feel lousy, you're not going to go work in your garden. You're not going to go play with your grandkids. You're not going to go out to lunch, right? You're going to be home like, no, I don't feel like it. But so that's not the best life you could be living today. The
Mm-hmm.
goal is to live the absolute best life you could be living today. And hopefully you get a whole lot of todays, but no matter how many todays you have, you should live the very best life that you can today. And so let us use all our tools to make you feel better. Often people will be like, no, they may even have medicines in the house. No, I don't need it. I won't take it. I'm okay. But if you ask them, like, are you not going out to lunch with your friends because you feel lousy? Yeah, I don't feel like it. So like they just made a decision to feel worse that's decreasing the quality of their life. So
Mm-hmm.
the whole focus is on what are all the things we could do. Manage your symptoms, manage your anxiety, manage your depression, manage your spiritual distress if you have it, so that you can really get all the goodness and juice out of life that you possibly can.
Yeah.
That's our goal.
Yeah, and that's super important because if you already are going through a very hard time with this like cancer or any other disease like that, it's already a big thing that you're going through.
Yeah.
So if you don't have this like support from anyone in any of all these aspects, it might be worse. So I think taking advantage of this palliative medicine and have that support, because you'll support in mind, body, and spirit. I think it's really great. Like literally, really use these tools that have been offered to you, and that you're able to take them, asking your primary physician, asking the hospital, and you're not alone. So that's like great news, because now you have a whole team that can really support you in many, many ways as they're fit, obviously. And I'm thinking also, is this where the parents go? Because I know diseases not only happen for older people, but there's also kids that might be going through these things.
Yep.
So in these cases, the parents also have to call for this.
Yes, it's a great idea. There is absolutely palliative care for kids, and it's really, really important. And that is a place where a lot of physicians don't think to ask, because if a kid is sick or has some potentially life-limiting illness, they're going to do everything they possibly can. And people who don't understand, even doctors who don't understand palliative medicine, will think that someone's saying we're giving up, we're not going to try to prolong their life. Not true at all. So it's so important to get palliative care for a child who has a serious illness. And one of the things that I love about palliative care is the unit of care is the patient plus the family, like officially. Whereas in most of medicine, the unit of care is the patient. And then there's family, and we care about them, of course, but like we're focused on the patient in almost all of medicine. But intentionally, palliative care is specifically about the patient and the family. Because when a family is going through a serious illness, it doesn't affect just the patient, it affects everybody in different ways. And everybody's well-being is tied to everybody else's well-being. And certainly with the child and parents, that's true, but it's true for anybody. And so the focus will be as much on the parents as it would be on the child.
Yeah, for sure, because they're like the caregivers for these people that are ill. So I know you mentioned for the parents, obviously, because they're the parents and they're taking care of the kids. But when like we talk about a woman with cancer, breast cancer, or things like that, do they break their family with them? Does the family has to call for this to get
So
do they come together? How does that work?
Often they come together. So like I said, since we are all about the patient and family, they often will come together. And in the ideal scenario, if it's a good family relationship, we'll ask the patient, like, who is your family? And even I put family in quotes because it's family, like your husband or your mother or your sister. But also if there's a really close friend who's like family, then bring them too. They're family as far as we're concerned. But we'll ask the person, like, who are your people? And those people ideally will come together. And for important conversations, we'll bring everybody together. And sometimes if someone's in the hospital, there'll be some people at the bedside and some people are on the iPad, some people are on the phone, if not everybody can be there. But it's really important to have communication all together if possible. And then, of course, in some families, there's a fracture where not everybody wants to be together. And in that case, we will, with the patient's permission, sometimes talk to people separately from the patient if the patient wants that. But the goal, and we try to facilitate it as much as possible, is families working together. And sometimes there have been, fractures in the family, but when a serious illness comes to town, we can bring everybody back together and it can get healed, which is always a wonderful outcome when that can happen. And so that the palliative doctors, and not just doctors, the team, palliative team, considers that part of our job, part of our work, part of our mission. And palliative medicine teams often have not just doctors, they have often nurses or nurse practitioners, a social worker. The one that I most recently worked with had a mind-body specialist also, because we were an integrative team. They often have a chaplain. So because everybody has different expertise, we want to make sure we're hitting all of the pieces, the physical symptoms, the emotional symptoms, and the spiritual symptoms the best we can.
That's awesome. And then also for these services for the palliative medicine, are those covered under like insurance, or is this a service that people, because they're already going through a hard time as it is.
Yeah.
Are these usually covered, or?
Yep. Just like any other doctor. So it's a specialty.
Great.
So doctors are board certified in it. I'm board certified in palliative medicine. So you have to take a fellowship and sit for a board exam every 10 years. I just did
Mm-hmm.
it. Phew, just
Yay.
passed again. Thank goodness. I'm good for 10
Yay.
years. But we're considered specialists. So it's just like if you went to the cardiologist or the neurologist, going to the palliative doctor is the same.
Oh, okay. Yeah, and that's pretty good too, for people, because some people might think like, no, I'm already going through all this thing. I don't need this. What is this? That I don't even understand. But I think
Yeah.
it's really good, and as you mentioned, a lot of people has never heard of it. Personally, I in my family, cancer runs in the family. So my grandfather passed of cancer. One of my aunts passed of
Sorry.
cancer, and my dad passed of cancer. And I never knew of this service in any of
Wow.
those three scenarios. Right? Nobody like mentioned anything
Wow.
to us, to the family. So I think it's really great to actually have a support system, especially when they're doctors and they know what they're doing, and they can actually help with all these different facets of the illness or what you're going through. And so it's pretty amazing. I mean, I'm glad there's services like that people can actually go to it and have a better outcome with their illness.
Yeah, thank you. I agree with you. I'm sorry for your losses. I know that must
Yeah,
be really
no,
painful.
yeah.
So you're right. You're exactly right. And so much of medicine is focused on the disease. And on the one hand, that's good, because if you have a disease and there's something that someone can do to fix it, please do that, right? Like if you have
Right,
cancer and chemo can help you, then please get chemo. I plan to do that if I go down that road, for sure.
right.
But in that disease focused care, like let's work on your heart, let's work on your cancer, let's work on your kidneys, let's work on your brain tumor. Um, where's the person? Where's the human? And
Mhm.
not just the human, but their family. Like, where's that? And that's where palliative care came up from. That's why it exists, is people realizing that you can go to the doctor and get your disease worked on, but sometimes it makes you feel worse. Like the
Mhm.
getting chemo doesn't make you feel better in the beginning, right? Before you get it, you feel okay, and then you get it, and then you feel terrible. You're doing it for a reason. You're trying to kill this disease or slow down this disease, but you yourself as a person, you feel terrible, and your whole family may be disrupted. Like maybe you were the one who cooked all the meals, and now nobody knows what to do because you don't feel well, right?
Mhm.
Maybe you were in charge, and now you're not in charge, and the whole balance of the family is upside down. Maybe you can't sleep, or maybe you're crying all the time and your spouse doesn't know what to do about that. Maybe your kids don't know how to talk to you and everyone's like in their own corner being sad, but no one's communicating. All of those things happen while
Mhm.
your cancer doctor is treating your cancer. So the whole point of this specialty is to look at what suffering a person or family is going through and how can we relieve it. Can't always take it away completely, but we certainly can take a lot of it away, and it's worth working on. And so I think that's kind of the philosophy of palliative care, is you as a human being,
Mhm.
not as a disease. And if you are suffering in any way, how can we help lighten that load? How can we help make it better?
Mhm. Yeah, that's really cool. I think this is like a really awesome service and tool for everybody that's going through like a really, this big disease or like a life-changing thing. Because you don't have to be the patient, but if you're like the family member that is going through this, you can actually look into this and
Yeah.
get some help that way. So that's really awesome. What are some of the really cool things that you've seen with palliative medicine that you've gone with your patients that you have helped?
Sure. Um, Gosh, it's hard to choose because there's a lot. The first thing that popped in my head, I'll go with this one. We've seen a few times, more than a few times, is people who were struggling to do the conventional treatment, like they were too anxious to get radiation, for example, because some kinds of radiation you have to be kind of tied down to the table, and they're too anxious, they couldn't get it. And so maybe that was going to mean their cancer might come back sooner because they couldn't get the treatment. But with integrative palliative care, so talking with them, managing their anxious thoughts, teaching them some breathing techniques, teaching them some meditation techniques, maybe giving them a guided imagery to listen to, having them imagine that when they're getting radiation, that it's the warm sun that's healing them, that when they're getting chemo, instead of people say like it's poison, we might give them a different image to hold that's about, powerful, strong energy medicine that's helping them. And so sometimes this palliative approach can make people more likely to be able to tolerate their regular approach, like their doctor chemo kind of treatments. And that always I thought was wonderful, because it not only is helping their symptoms, it actually is potentially prolonging their life, because it's helping them get the treatment from the specialist that's trying to go after their disease. And I have had quite a few experiences like that with patients that I think is really important.
That's awesome. Yeah, I think just little things like that that help the patients. I mean, these little services that you could do here and there with them, I think are can make a really big difference on the outcome of their treatment. So that's like super important. And it's awesome. And we talk about kids. Do you have a lot of patients that come with you that are kids?
I have not done a lot of pediatric palliative care. The place that I most recently worked did have a whole division that was pediatric palliative care, but I don't have experience in that. Once upon a time, they came to our team when I was working for hospice and said, "Do you guys want to integrate kids into your
Yeah.
team, or do you want to make a separate team for kids?" I had young kids at the time, and I felt like I couldn't do it. I just felt
Yeah.
like I couldn't do it. So it's a special person that can do pediatric palliative care. They're like angels, 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 but it's really a wonderful, wonderful service. And even on hospice for kids, the rules are different. They can be getting very aggressive care and be on hospice at the same time. So the thing that in palliative care we always think is so funny, when people say, doctors even will say, no, they don't want it. They don't want palliative care, or it's too early. Our whole focus is just on making you feel better. Like, why would you not want that? Once people
Right.
hear what it is, they're like, oh no, I want that. The thing where they're going to
Yes.
actually make me feel better. Yes, I want that. So it's just a marketing problem that the whole
Yes.
field has.
We need to fix that. No, but
Yeah,
that's awesome. And I love everything that you guys are doing. I know you also I think you have some courses and things like that, right? That you are working with MDs too.
I do, because I realized doctors don't know how to do this, and it's not really that hard. And
Hmm.
everybody should know, because it makes such a difference for the patient. And not only does it make a difference for the patient, which of course is the most important thing, but it even helps the doctor, because doctors almost all went into medicine because they wanted to help people. Excuse me. And so when their patients have a whole bunch of symptoms and they feel terrible and they're calling up like, I feel terrible, and the doctor's like, I know, I'm just giving you the thing you need. I don't know what to do about the fact that you feel terrible. The patient feels badly, the doctor feels badly, their connection is not as good. The thing that feeds doctors to do the hard work they do often is the helping people, having a
Hmm.
patient say, thank you so much, this really helped me, I'm so glad you're my doctor, like that fills doctors up. And so teaching them skills, integrative skills, palliative medicine skills, counseling skills, to help people feel better from their office helps the patient, helps the doctor, helps the relationship. And the other good thing is that when you use this integrative palliative approach, which is really like a mind, body, spirit approach for your patient, you can't help but have it rub off on you a little bit as a doctor, which makes the
Hmm.
doctor more well, which is
Hmm.
also better for the patient, because when doctors are burnt out, their empathy goes down and they're not as nice and they're not as good to the patient. So it's like a positive feedback loop.
For
And I feel
everybody.
like we have to spread the word. That's my goal. We have to spread the word, train more doctors. That's my
Yes.
goal.
Yes, for sure. That's as I said it earlier, this is like amazing thing that you're doing, especially, working with the MDs. They already have so much in their minds that, um, don't want to think about anything else, but this is great. They're going to make their practice better. They're going to feel better. They're actually going to care for the patients, and it's like a win-win for everyone. So this is
Yeah.
amazing. And I'm so happy I came across, you, because I wouldn't never know what palliative medicine is. So I really, really love it. Thank you for all the information today. I know everybody that's listening today, they're like, oh my God, why didn't know about this? So this is great. And before we leave, is there anything else that you would like to share with us?
Sure. Um, Two things I think. One is just from a perspective, sometimes people feel like, oh, isn't it depressing to do this sort of work and see people who have illness? But what I want to share with everybody is it's the opposite, because it just is such a reminder for all of us to focus on what matters to us today. To stop
Mhm.
worrying about the stupid things, stop doing things that we hate, stop committing to things that we don't want to do, focus on what makes us happy. You don't have to
Mhm.
wait to get cancer to have that approach. Like, wouldn't it be better to do that and
Yeah.
not have cancer? Right? Like,
Yes.
we all
Yes.
should be doing that. And I would love to have people contact me. So my website is integrativepalliative.com. Palliative has two L's, integrativepalliative.com. Send me an email, go there and sign up for our newsletter. I won't spam you or anything, but I just want us to build a community. That's my goal, is to build a community. And then I do also have a podcast focused on healthcare providers called the Integrative Palliative Podcast. If anybody wants to come join, I'd love to have you listen. And if you have any questions, go to the website, you'll see my email, and just email me. And I want to raise this conversation. So I'm so grateful to you for letting me come share about this. Thank you so much.
No, thank you, doctor. And I will put all her information and all her links on the show notes for everybody that wants to get in contact with the doctor, or if you have any other questions, please do ask. All my guests love all these questions. They want to keep on the conversation and help out if you really need certain things here and there. So I will put all the information in the show notes to contact the doctor. If you would like any more information about me, you can go ahead and look me up at alexvalga.com. You can find me on Facebook, Instagram, YouTube, Twitter, pretty much everywhere. And also, don't forget, my book is out and you can get it on Amazon and Barnes and Noble. It's called Parents Are Greatest Teachers. Thank you, everyone, for being here. And thank you, doctor, for all this amazing conversation and information. And everybody, have an amazing day.